So I'm doing this video because like I said before, I usually am a good intuitive individual, and when it comes to these type of circumstances, and so I guess that's the best way to put it. But this is one of but many of the things that I'm fearing or feared that would happen. I'll say feared that would happen is that before I read this article, let me explain to you what I'm really believing that this is that the numbers of cases of COVID-19, the people that are infected are a lot higher. And I feel like what was going on is there was some dishonesty, a lot of dishonesty, as a matter of fact. And some of that was coming from, I don't even want to say, because I don't know if I should say that, but I'm going to keep that part quiet. But I can already see the conversation being talked about. Let's put it like that. So the numbers were a lot higher. And I will say this, there was a lot of public pressure to get people to go back to work. And it was mainly about the economy failing. And I will say that. And so if you didn't realize how bad it is really bad. There are literally some businesses that are not going to be open anymore. They have lost a great deal of money. There are developers that are looking at cutting their losses. They're pulling out. There are landlords who are not able to actually carry out evictions until far later than what they had anticipated. There are situations where people are not really ready to go back to work because work is not there and they are not ready to open up because they have not, let's say, they have not gotten a green light to say you're clean, you're safe, and you're ready to start working and accepting staff again. And so I think too, like I said in a previous video, there were businesses that were opening left and right, and I believe what they're going to try to do is they're going to try to see if those businesses are going to follow the rules, and some are, and some are going to do the best that they can. But I'm afraid that some places are going to re-close. Some places won't close until people start becoming ill or getting sick. There's going to be more hot spots. There's going to be more numbers of people that are going to contract COVID-19. Like Dr. Fauci said that he hadn't seen anything like it in, I guess, 40 years or more than 40 years. So, you know, I'm really intuitive about these type of circumstances. It's unfortunate. And if you're wondering if I had a video, I had a video, and it was actually, I had to shut the video aside because I guess, you know, whenever the videos have to do with politics, some people are able to dish out, but they're not able to take criticism. And so I'll just say it like that. And so my videos, I never threaten anyone, but people will feel oftentimes threatened because of the circumstances that are going on, because a lot has been going on lately. There has been a lot of revolts. And let's just be honest here, there is going to be more. And it's not just because of racial discord, it's also because you have some people that are about only money and greed and power. And this article is out of the AOL, and it says what I had always had been and suspecting is that the CDC says that COVID-19 cases in the U.S. may be 10 times higher than reported. So this is by an Erica Edwards. And so these are articles that are public. And so if there were anything, and I'm just going to give you something here. If there was anything that you recall that I had previously had in a video, it is open to the public because they have these, some of these articles are easy to find in Yahoo or in AOL or in Huffington Post. And so they're not all articles that, they're not like I wrote them by hand. And so I'm merely a good discerner of finding some really great articles that are well written, and it pulls out some of the most current events and some of the most debatable content that sometimes is political, or most times is political and debatable, and it has room for opinion and critique, and some people are able to dish it, but they're not able to take criticism. And so some of these social media sites take things personal because I'm sure that they have their own set of biases and their own set of beliefs. And so they take things far personal and internalize it. And so sometimes you have to step outside and say, hey, you know, we have a lot of content and there's some things that are far worse than someone critiquing a news article. But the CDC is reporting that there's 10 times higher of cases of what we heard the numbers of COVID-19. So in other words, that's why we're hearing from the governors and we're hearing from various people that are influential in politics, like governors and people who are of interest, that are reporting that the numbers of COVID cases have surged. So the true number of Americans who have been infected with COVID-19 may top 20 million according to the new estimates of the Center of Disease Control Prevention. So our best estimate right now is that for every case that's reported, there are 10 other infections. So CDC Director Dr. Robert Redfield said on a call with reporters Thursday. So the estimate comes from looking at blood samples across the country for the presence of antibodies to the virus. So for every confirmed case of COVID-19, 10 more people had antibodies, Redfield said. So currently there are 2.3 million COVID-19 reported cases in the U.S., and CDC's new estimate pushes the actual number of coronavirus cases to 23 million. That's a lot of people. So this virus causes so much asymptomatic infection. So there's apparently a lot of people who don't show the symptoms, but they can function and maybe they carry it, and they could be even possibly super spreaders. So I'm just saying that that might be how it's able to be passed to so many different people when the time is presenting itself, if they're in a crowded environment, or if they're unmasked, or if it's in an unsafe setting. So the traditional approach of looking for symptomatic illness and diagnosing it obviously underestimates the total amount of infections. So estimation comes amid rises in cases across Southeast and Western U.S. So he had urged Americans to be vigilant about behavior measures known to minimize spreads of the COVID-19, the coronavirus. So the most powerful tool that we have is social distancing. So Redfield said this, not Antoinette 70. So that means maintaining a physical distance of at least 6 feet in public, wearing face coverings, ongoing, and washing hands. And so those are the simple ways of protecting yourself. But if you must go out into the community, being in contact with fewer people is better than many people, Redfield has added. And so the other thing that I noticed in another article, which was pretty interesting, is that LA's mayor urges residents to stay home as the coronavirus cases are spiking. And so this is going to be complicated because it's summer. A lot of people want to get out to the beach and they want to go, do family outings or maybe friend outings, and so that could be possibly problematic. And so just with our everyday lives have been interrupted and changed around because of this virus. And so some of the things that some people maybe took for granted now become very valuable. Just being able to go out with your friends, being able to go out with your family and have quality time, go to vacation spots, seems to be a challenge during the pandemic. So amid record-setting spikes in newly confirmed coronavirus infections, LA mayors Eric Garcetti urged Angelenos to continue staying home as much as possible. So even as the region economy gradually emerges from the pandemic-induced coma, because even though there's more spiking, they have opened up some businesses, and then some people are trying to see if they can get part-time employment or do something to kind of keep things afloat as best as possible. During that you still have to follow the guidelines. So during a briefing Wednesday, Garcetti shared 4 major takeaways. 1, COVID-19 is still here. 2, COVID-19 is still dangerous. 3, we're adding more testing to make sure that we can find COVID where it lives. And 4, we must continue to take precautions to keep our city and our people safe. So that's why wearing a face covering, that's why practicing physical distancing, washing hands, yes, and yes, as painful as it might feel, staying at home whenever you can is the best defense. And so starting Thursday, Garcetti said that LA would dramatically ramp up capacity of COVID-19 test sites from 7,700 to 13,700 tests per day to meet increased demand. Now I'm going to stop right here. Now, I don't know if you heard this, but I heard that the testing was supposed to be slowed, and that Donald Trump was mentioning this, and that he was going to, by the end of the month, of this month, possibly end the testing. So I don't know if that is going to actually happen or not. And so don't quote me on it, but I know I saw a few articles that was saying that, and that sounds alarming since the COVID is starting to spread again and spike in areas and becoming problematic. So there have been nearly 90,000 confirmed coronavirus infections and more than 3,200 deaths in LA County alone. And so the total caseload has been fueled by significant spikes of late, including several days in which the country reported more than 2,000 new infections. So I know that this is difficult. It's summer, like I was saying before I even read this, and it is difficult because in the summertime here, especially in Los Angeles, people like to go to the beach. They like to spend time with their family and their friends, and they as in Angelenos, probably since 4th of July is coming. Some people celebrate that, while others may celebrate Juneteenth. And so let's mention all the different events that people gather for. Some people are probably going to just be out because it's summer, and maybe they're not into particular holidays. So it goes on to say that I know it's difficult. It's summer, restaurants, bars are open, and things seem like they're back to normal. And that's what a lot of people want, things to be back to normal, because it kind of sucks because people have been, in for a while. They haven't been to work. People are worried about their financial stability, and so people want help and need help emotionally, maybe mentally. They want, at least some comfort from family members, maybe friends. They want to be able to at least enjoy their summer um, before they have to go back and take up a part-time job or something to keep things afloat. There's a lot of things we're seeing that are developing. Some people take the racial tensions in other ways as a teaching time, or to try to vent in poetry and reading, or in learning more about how to teach others, or how to learn more about other cultures. Some people have had it and they are more militant about their feelings and they want to express it in other ways. Not saying that everything is a good way, but it depends on what circumstance you're presented with. So let's be clear about this. The other thing is that looking at, because it's summer, people are going to want to be out more, because more than likely, especially here in Southern California, it gets really warm. And so it begins to warm up, and the beach just calls you, or just even trying to take a walk, with your pets. So LA County Public Health Director Barbara Ferreira said Thursday, but they're not. The virus is deadly and the virus remains in the community. So you have to be vigilant and you have to be aware that, going to restaurants and bars poses a greater risk. And so if you do go out, like Fossey said, that you need to have a mask or mask up. So health officials have repeatedly said that the case counts would rise and more business and public spaces are as they reopen. So California set back-to-back records this week in terms of the daily reported coronavirus cases. So the state shattered the daily record for the new cases on Monday, reporting more than 6,000. And that's what I previously said in a video prior to this one, 6,000 infections for the first time. So that's in LA County. And so actually the numbers are a lot more projected higher than that. That number has surged even higher Tuesday, when it was going from 6,000 to 6,652 new cases that were reported. And so the state reported 4,629 new cases on Wednesday, according to the Times coronavirus tracker. So pushing its cumulative past 196,000 cases. So more than 5,700 Californians have died from COVID-19, including 98 on Wednesday, which is very sad because of what is going on. And you feel like you're doing your best. I've heard stories where people feel like they're doing all that they can, but they somehow still end up getting it, or they get it and they don't have the major symptoms, and they give other people, their loved ones, the virus and they have the major symptoms, and it's sad. So you kind of feel some type of way, like you're guilty. But as the cases rise, and I'm saying this, that it's possible, even if you're going out trying to do the right thing, that maybe you somehow came in contact unknowingly with someone who was infected and you brought it home and it wasn't your fault. And so that's the scary part, but that's why you have to be really careful about what places you go and your your social distancing. So cumulative cases counts are only part of that equation. So health officials have said other metrics, such as the number of patients who require hospitalization and positivity rate, help paint a more complete picture of the coronavirus outbreak. So however, there are warning signs there too. So Governor Gavin Newsom warned that Californians on Thursday about the growing spread of the coronavirus, as the state again reported increases in hospitals. And so the hospitals are now being overwhelmed because more people are going in sick. And I'm hearing that they're younger. And so the governor's news conference marks the third time this week that He has urged Californians to take more precautions as he disclosed troubling new highs. So I cannot impress upon people more than an importance at critical juncture. So when we are experiencing increase in the cases that we have not experienced in the past, to take seriously this moment. So Newsom has said this. So if we do, we can mitigate and we can bend, in other words, the curve. So we ultimately can rebound and become more resilient still in the future. So Newsom said Thursday that patients hospitalized with COVID-19 have jumped 32% in the last 2 weeks. And so that's 4,240. So this is doubled the 2 week increase, 16% that was reported on Monday. And so the rate of positive cases remains stagnant, 5.1% over 2 weeks compared with Wednesday, he said. So the governor has pleaded with residents to wear masks, maintain physical distance of 6 feet to one another. He's advised those over the age of 65 or with chronic medical conditions to remain at home. But beyond telling Californians to heed the state's mask requirement, the governor has not reinstated any of the restrictions that he began easing in early May or demanded the counties experiencing surges shuttered businesses again. So 15 counties in California, including LA, have reported an elevated transmission of the disease, increased hospitalizations, and limited hospital capacity that exceeds the state's guidelines. So Contra Costa, Fresno, Imperial, Kern, Kings, Los Angeles, Riverside, Sacramento, San Bernardino, San Joaquin, Santa Barbara, Santa Clara, Stanilas, and Tulare and Ventura. So Stanilas. So correct me if I'm wrong on that pronunciation. So Newsom Thursday said that he would consider toggling back and reinstating restrictions in the health care needs if they begin to exceed. So basically, if the hospitals get really filled up with a lot of patients and become overwhelmed, they may have to start making some closures for the safety of Angelenos and people in LA County, period. So they don't want those numbers to get so high that it becomes like really like a super emergency where you have just nothing but sick folks, and it is starting to edge up. So that is the fear. While LA County saw the average of 62 fewer hospitalization patients daily for confirmed or suspected cases of COVID-19 between the week of Memorial Day and last week, Riverside County saw an average daily increase of 85 patients, San Bernardino County 70, Ventura County 33, Orange County 32, according to the Times analysis. However, LA County has seen its daily number of hospitalizations tick up recently, something Fiera called extraordinarily worrisome. So Orange County also reported 26 COVID deaths on Wednesday, so it's most in this single day that it had. So officials noted that not all of those people died on a particular day. So the recently reported fatalities date from as far back as May 9th, according to the Orange County Healthcare Agency. So a review of the death certificates resulted in the confirmation of 26 new deaths. The agency reported on Twitter post offering the sincerest sympathies of the lives of the lost to the virus, no matter the day. And so despite the increase of the confirmed infections, elected and health officials have not indicated an imminent need to reimpose the kind of restrictions that shuttered and battered California's economy. And so listen to that. That shuttered and battered California's economy. So I believe they got a lot of public pressure when people were going out and they were protesting to reopen things. There were some people that were becoming really rude. They were irate. Some people have been demanding not to be turned away from businesses because they don't want or refuse to wear masks. They feel their constitutional rights are being taken away from them. There are some people who they had some people who were caught in videos that were actually violating other people's rights in physical space by not stepping away, or either they're actually spitting on people or they're breathing and coughing on people. There have been some videos that have surfaced with people that are doing these things and who have admitted that they are infected or were infected, that is, to scare others. And so it's really problematic, and so it causes alarm. So, however, back to the video of this article, it says, however, they continue to emphasize that individual actions shape wider conditions. So if residents or businesses don't follow public health guidance, they potentially create a more fertile environment for the virus to spread even more. So each one of us takes responsibility for doing what we know that we need to do to protect ourselves, Vieira said. So over the weekend of May 30th, June 6th, and June 13th, so Vieira said that the county inspectors visited 3,751 restaurants and found that 83% of them were not in full compliance with the coronavirus safety rules. That's another issue. So some of these places are opening up and they're not yet sanitized. They're not safe enough for people to enter again. They're not clean enough, and they've not been, given the green light as you would to start accepting staff and people, customers. It's not safe. So most of our work to date has really been providing assistance to restaurants as they reopen so that they can come into compliance. So you have to be in compliance before you can reopen a business again, or a workplace. So Newsom's warned that Wednesday, the counties that fail to abide by the COVID-19 guidelines, including the recent face covering mandate, which I just mentioned, could lose state funding targeting the coronavirus outbreak. And so the governor last week ordered all Californians to wear face coverings while in public or high-risk settings. So a move that he was aimed at slowing the spread of this virus, the coronavirus, and helping keep the state's reopening plans on track. So, however, the requirement has been met with resistance and derision. And so in some corners of the state, some residents and elected officials have pledged not to follow the order, and some law enforcement agencies have said that they will not enforce it. And so this is sort of hard to govern when you have people that have their own rules. Even though rules have been set to save their life, they have their own theories or rules. And I did a video where you can see people who don't even believe that this virus actually exists, or they have videos floating around where people think these events are complete conspiracies or hoaxes. And so I won't even go into that. I think you've seen one of my videos. And so I'll go ding, 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 question mark. You can hunt for that. That is all over. It's on Twitter. And so because the coronavirus respects no boundaries or borders, okay, so it says, Newsom said that is exactly why he looked forward to signing the budget that will afford me a little bit of leverage in the conversation, and I think that's appropriate next step. So the virus respects no borders and boundaries, and it basically can go anywhere and can infect anybody. He said that he hopes that leaders across Southern California will act together so that if the things do get bad, that we do need to retreat at all. If we do need to retreat at all, we'll do that in unison. So there's been a fight among fights, a battle that has been ongoing. And so some people are really militant about their constitutional rights, and they feel like this is a plot. And like I said in the other videos, that it's not me, but I'm getting it from different sources of articles and different incidences that happen around the world, where some people have posted things where they feel like they've been duped, or they've been hoodwinked, so to speak, that somebody's setting them up. And so there's a lot of distrust. There's a lot of fear going on there. So I do, going back to the article, says I do think that we can get through this. And this is from Gavin, or actually I said Gavin, he said, I actually heard him say that, but Eric Garcetti saying that we do think we can get through this without seeing a huge surge. But that relies on each and every one of us, he said. So it relies on us not being macho about wearing a mask. And I'm not going to say any names, but we know who said that they didn't feel like they should wear a mask. And so that it didn't look appropriate for them to wear a mask because they would look stupid in it. I don't know if you saw that article, but, I'll leave to each his own. So it relies on each of us doing the things that we know to do and being patient. So with 4th of July, just around the corner, the officials continue to emphasize the importance of taking steps to reduce the risk of coronavirus spread, such as physical distancing, frequently washing hands, and wearing face coverings, and trying to be careful about the large gatherings with people in different households. People will go and visit people at different households and they crowd up. So we do recognize that families will want to be together over the holidays. It's sort of like I already said this before I'm reading it. But being able to minimize the people that you're around, particularly people that you have not been around in the past, is particularly important. So Dr. Jay Butler, Deputy Director of Infectious Disease and COVID-19 Response, Incident Manager for the U.S. Center of Disease Control Prevention, said during a briefing on Thursday. And so these are articles that I'm reading. Some of it is opinion. Some of it you see is factual because you'll see more than one person responding, and then some of it is debatable and it's critical and it's political, and it's current events, things that are happening or are most people are experiencing and familiar with. And so it's a thing of, how do you feel? Some people feel personal about certain things than others, and I understand that people want to be respected, and you are respected if nobody's threatening you and nobody's trying to inflict harm on you. But if you're putting videos out saying things that we know we all see happening right before us and saying that it didn't happen, that right there, I think, is pretty scary. And so I think the public needs to know that. That's my opinion, and I'm entitled to it. I feel like when things are happening, people want to know, and I want to know. I don't want to be in the dark. It's like if there's an earthquake going to happen, we can't predict it, but if I feel an earthquake and other people are busy about their lives and maybe they don't feel it in one area and another person feels it in another area, the news has no problem telling everyone, right? So it's just one of those things. So anyway, I'm going to expound. These are two articles. One was out of AOL. I think the other one was Yahoo News. But I'm going to let these videos go for now until some other developments happen. But this is usually what we're seeing now in terms of the new normal. People with face coverings and they're further apart, but they still want to have fun. But anyway, with that being said, I'm going to let this video go. So what do you think about some of the new things that are happening? You can leave your comments. I don't know. I just think a lot of things are going to happen. I think there's going to be more protests. There's going to be more people that are going to come in and they're going to say what they want to say. And there's going to be more developments. There's going to probably be more sick people. And then some people are probably going to recover. Some people will have a mild case and others may not. They may experience something different. So I think it's true. We just have to really try to be careful and be as safe as possible and try to make it through these times. It's really hard for a lot of people. And some of the stories that I've been seeing, a lot of people are suffering in some type of way. And I did see some other stories where people are getting more wealthier or they're hoarding their money because they're afraid they're going to lose money. Maybe they've lost a great deal of things already, properties, things they're worried about, maybe they need to sell. But then on another scale, you have people who are worried about losing their lives. They're worried about feeding their family, if they're going to have food to stretch. And so, which brings me to this, before I end this video, I was also hearing talk of they possibly could end the unemployment insurance. And so for some people, that's a lifeline. Maybe people have other ways of trying to produce money, but not everyone. And so some people didn't even get unemployment insurance. There are some people that are waiting to see if they can get rental assistance. Some people are waiting to see if they can get mortgage help. They're worried that they're going to lose their homes, default on their loans, maybe go into foreclosure. So there's a lot of fear out there. But anyway, on that note, we have to do what we can with maybe very little or as much as we have. And it'd be nice if people who have more to try to help others out and look at what's going on and try to change some of the biases that you maybe previously had. Try to, work those things out, see if maybe, you could learn about someone else and learn about what they're going through. And then also maybe they could learn about how you feel and what your position is on certain issues. But having said that, I'm going to let this video go. Like, comment, subscribe, and thank you for listening. This is Antoinette 70. I am out.